So once we have everyone seated, we'll start the session. And so far, it's been a really great day, and we've heard of different approaches that companies are engaging in and different methods of accomplishing the common goal. Now we have a very interesting panel that's going to talk about market-based solutions to drive innovation through creating financial programs, instruments, and again, very unique. We purposefully selected the panelists here today because each one of them brings a very different perspective to how they are playing a role in furthering innovation, but with an intention of keeping them sustainable and scalable. And both these are important goals of our workshop, so we'll hear from them. Peter Singer, I really want to thank Dr. Peter Singer, who's joining us from Geneva this late hour. He's there for an important reason, which he will hopefully tell us news hot off the press. For anyone who was at the World Health Assembly, Peter is known to make announcements that are just hot off the press, so we're expecting something here from you, Peter, as well. But Peter is the CEO of Grand Challenges Canada, and he's dedicated his efforts and services the last decade to bringing innovations to tackling the world's most important health challenges and for the poorest people. We have Alan Staple to my left. Alan is the head of global markets team at the Clinton Health Access Initiative. And he has been there for 7 years, obviously has a private sector industry experience prior to that, and I consider him to be one of the lead experts in market dynamics. Glenn Rockman, sitting next to Alan, comes with a unique and interesting background, 10 years at JP Morgan, investment banking, guiding financial decisions and investments, and then worked closely with the Bill and Melinda Gates Foundation to establish what's called the Global Health Investment Fund and moved on to be part of GHIF. So each one of these speakers will bring their unique perspectives on how they are spurring critical investments and innovations and doing that with an eye on reaching scale and impact. So with that as the backdrop, I'd like to start with Peter, who's joining us from Geneva, where it's really hot, I think. Yep. And we're going to have Peter tell us about Grand Challenges, tell us about your role and your passion for driving innovation, and what are you doing in Geneva at this point?
Thank you very much, Renuka, and it's great to be with everybody. Can you hear me okay? Great, and I really appreciate the opportunity to be on by video conference. I actually am here at the Global Finance Facility Investors Group meeting, and that's a holistic, country-led way of essentially promoting the goals of survive, thrive, and transform of the global strategy, and making sure that women and children survive and thrive, women, children, and adolescents. And it has a private sector element. I'm the private sector rep to the Global Finance Facility Investor Group. And just tonight, we were talking, for example, at the country level in Kenya about how Kenya has effectively started to work with its private sector to accomplish the goals of maternal child survival and thrival, and to transform the system. And that's just a little snapshot of what I intend to talk about. If I take a step back, your overarching question is how can the private sector, and in particular the interface between the public and the private sector, advance the Sustainable Development Goals? I would flip that question around and say that I think it's becoming very clear that we won't achieve the Sustainable Development Goals without the engagement of the private sector and without the innovation that the private sector brings. This became, I think, very clear in the Addis meeting last summer, which was about financing the Sustainable Development Goals. And my short version of the outcome of that meeting was that it's really about countries and companies. And, you know, the $135 billion or so of official development assistance, of which 30-something billion is devoted to development assistance for health, is not sufficient to tackle the challenges that we face, even in health. And so, not to mention the other Sustainable Development Goals. And so domestic governments, resource mobilization, and the role of the private sector becomes really critical. You know, on a $75 trillion world GDP, most of that is in the private sector. The private sector really does need to participate, and they are beginning to participate. For me, the question is no longer whether the private sector and the public sector should work together to achieve the Sustainable Development Goals. The real question is how, and that's where we get into your agenda with barriers, frameworks, models, etc. And what I want to do in the next few minutes is just use the experience of Grand Challenges Canada and some concrete cases of public-private partnerships to try and inform that in one specific area, which is innovation, happens to be the area you're focused in on, recognizing there's other areas of private sector activity. The fundamental vision, actually, of Grand Challenges Canada and of our founder, the late Joe Rotman, who was a merchant banker, was to see all the sectors working together for innovation with impact. He developed this idea of integrated innovation, which is bringing together science and technology, social, business, and financial innovation for sustainability and scale. So that's the fundamental vision we've been working on for the last 6 years or so. There's really 3 places we come into contact with the private sector, and I'm going to zero in on one of them. We do support a lot of social enterprises, and some of those are private, small companies. We do get involved in financial innovations, and you're going to hear about one of those from Glenn Rockman. Grand Challenges Canada is fortunate to be one of the anchor investors in the Global Health Investment Fund. We've also helped develop a development impact bond in Cameroon to scale kangaroo mother care that the World Bank, through the Global Finance Facility, announced $2 million of investment into. But I'm going to focus in on the third area, which is multinational corporations. So, by the way, as you're developing your framework, those are 3 areas of private sector activity you might think about. The main lesson, let me just give you up front, is that you can't push a string. And public funds were funded by the Government of Canada or other governments of the world, foundation funds. You can source innovation, no problem. You can even do modest size investments to help transition innovations to the next stage. But what you can't do without the private sector and without domestic governments in low and middle income countries is you can't scale. So my bottom line is you can't push a string, you can source, but you can't scale. And that's why the private sector is so critical in terms of innovation. Just a little bit about Grand Challenges Canada before I turn to the 3 examples. So as I mentioned, we're 5 years old. There's about $400 million of Canadian pledge towards Grand Challenges Canada, of which we've expended about $200 million. We've leveraged $370 million in the context of spending that $200 million. We supported about 700 innovations in 80 countries with a strong focus on reproductive, maternal, newborn, and child health, strong focus on mental health, but actually across the board. And those innovations are expected to save between 500,000 and 1.5 million lives, and to improve between 14 million and 30 million lives between by 2030. So that's just a quick description. The lessons that we've learned are described in something I think has been circulated, and there's elements in there about smart partnerships, etc. So I'm going to zero down on the part of our lessons that have to do with this private sector interface and lead up to the 3 examples I'm going to give you. And that's the process we have on transition to scale. So of those 700 innovations, maybe 90% of them are seed innovations, so they're $100,000 to $250,000 grants. But we want to pick the best 1 out of 10 to actually help transition to scale, always with co-investment from smart partners. Very extensive management due diligence, investment committee process, board process, not dissimilar to what Glenn might describe. And then more generally, we're hosting the Every Woman, Every Child Innovation Marketplace because no one group should only be looking at its own pipeline. We want the most promising innovations from any pipeline to help broker deals transition to scale. So enough about process. Maybe just the last point I would make is if you want to source innovation, you can use grant finance. But if you want to scale innovation, you have to use non-grant finance. And we've used about $30 million of repayable grants, debt convertible to equity, and even a little bit of equity. And you have to do that because if you're making those investments, as I'll say in a moment, you can't be subsidizing the private sector. You have to be entering as a smart investor, and everyone has to share in the success. So let me now give the three examples and then some closing final remarks. First example I think you've probably already heard about, which is the BD Odon device. That's a great example of early investment by Saving Lives at Birth, partners being USAID, Gates, us, Norway, UK, and Korea. So early de-risking, $250,000 grant, and then picked up by BD. They went and found further investment to transition to scale. Second example from BD, I think you've also heard about, which is the Gestational Diabetes Diagnostic through the Global Health Investment Fund. That's an example of where the investment really is at the transition to scale level, the $1-2 million investment that then is partnered. So BD examples, de-risking early with a grant and then transitioning to scale with an investment. GSK, the example I want to use is the inhaled oxytocin, prevents bleeding around the time of childbirth. That was a $16 million deal where GSK put in a significant amount, including their expertise on asthma inhalers, because this is about putting oxytocin in an asthma inhaler so it doesn't have to be refrigerated and doesn't need a needle. But we put in $1 million, Australian foundation, a Swiss foundation, McCall McBain Foundation put in about $2 or $3 million. So it's combined finance. Ours was in the form of a repayable grant. Actually, the Australian university is repayable on royalties. Again, good example of de-risking, because the initial investment, the initial grant was from Saving Lives at Birth partners, and then the transition to scale investment. Third example I want to use is Philips Charm. It's a device, it's a respiratory rate monitor. Pneumonia is the #1 cause of death of kids after the newborn period. 900,000 or so kids die. The issue is predicting who's going to get sick. Respiratory rate measurement visually is inaccurate, so this is a device that goes around the baby's chest and provides an accurate measurement of the breathing rate, the respiratory rate. We provided a $600,000 repayable grant that was matched by Philips. So in all these cases, we get our money back if the thing is successful, and we're not cross-subsidizing necessarily the private sector, but we are decreasing their hurdle rate and we are cushioning the risk. So those are all examples of what public finance can do in terms of encouraging private investment and working with private partners to move innovations towards scale. But it's not the end of the story. And what is the key next bit, and this is the bit that I think is not well worked out yet by anyone, and Gary probably alluded to it, is the issue of procurement. So who is going to buy the Odon device? Who is going to buy that diabatomics thing, the gestational diabetes diagnostic? Who is going to buy the inhaled oxytocin? Who is going to buy Charm, the respiratory rate monitor, should those things be successful? And there's obviously a strong evidence component here where you need to be evaluating the effectiveness of these innovations as they roll out. And I don't think we've made enough, for example, of stepped wedge cluster randomized trials as the thing is rolled out, because you also don't want to wait for another 5 years to roll them out. But I think the key issue now is really the issue of procurement. Maybe evidence gathering, groups like WHO and UNICEF can help there. But on the procurement, you're really talking about things like the Global Finance Facility that is financing country plans, putting these innovations in country plans, and again, coming back to the issue that at the end of the day, it's domestic budgeting by governments, African governments, Asian governments, etc., and investments by companies that will help these things scale. You know, it's not that this has never happened before. There are a few good examples. I think, for example, the safety syringes of BD is an example of an innovation that's really scaled. The meningitis vaccine in North Africa is a good example of an innovation that's really scaled. They're linked to an Indian company with a lot of foundation funding and the engagement of PATH. And that's really helped bring the meningitis rate in North Africa down to about 0. So it's not that this has never happened before. It's just that the market to scale is extremely inefficient. The different pieces are highly fragmented. The trust isn't fully there. And the players aren't fully working together. And that's why these first examples, like the 3 I gave you, and maybe there's another dozen or so, are so critical, because the success of those examples will really be the demonstration project that drives the market. So in summary, all I've really said is that, of course, the private sector has to be engaged with the public sector and with public finance in the area of innovation if we want innovations to successfully scale. We can source them without the private sector, but we can't scale them without the private sector and the role of domestic governments. The real question is how. It's not that these things don't happen. They do happen, but they happen very inefficiently. The path from idea to impact is extremely inefficient. And that's why learning from the experiences like the ones I described in terms of the interface with multinational companies is so critical. Trying something, learning from it. These early successes are going to be very important. It's okay if it fails, if the technology fails, because that happens in innovation. But the type of failure we don't want is the failure that comes from just not paying sufficient attention, from people not getting engaged, from institutions not getting engaged in helping to develop the evidence, from institutions not paying for something that's effective. And that's what we want to avoid. That kind of apathy failure is what we want to avoid. I think these are exciting examples, and there's other ones, and they really do show that we have to shift our thinking in innovation from the push side, because it's very easy to fund a pipeline of good innovations. I think a number of groups shown they can do that, and you can do that with public or foundation money, to the pull side, the demand side, which ultimately means we're focused on private companies, large companies, and we're focused on domestic governments. And that's also what the Every Woman, Every Child Innovation Marketplace, and I know Natalie Africa from the UN Foundation is there, who's been so helpful in the interface with private companies. That's also what that's focused on, just to defragment the players, bring them together, broker deals to smooth the path from idea to impact. So I think that's about my allotted time, and I should just stop there, Renuka. I hope the point is clear, that you can source but you can't scale. The private sector is critical. The question isn't whether but how, and we need to learn from these examples, and probably where we need to focus is on the demand side, and particularly procurement. Those are the points I'd like to leave the group with, and be glad to engage in discussion. But I know Glenn will fill this story out, and I know Alan and others on the panel will fill it out as well. So I'll stop there. Thank you very much. Thank you for letting me participate by video conference, and look forward really to the rest of the discussion.
Thank you, Peter. Your points are very clear.